Dry needling is a technique to reduce pain, improve mobility, and boost healing process. Release myofascial trigger points. Insert thin needles into or near trigger points to stimulate muscles for contraction or twitch response. Acupuncture needles are the solid needles that do not contain any kind of medication. This is why the technique is called dry needling. Different sizes of the needles are used according to the area and the purpose. Trigger points are the taut knots or tender areas that develop in a muscle, highly sensitive and cause tenderness. Referred pain due to the trigger point is the pain that affects another part of your body. Stimulating a trigger point with a needle helps draw normal blood supply and release tension. The prick sensation can also fire off nerve fibers. Superior to inferior direction and inferior to superior direction. Lateral to medial direction for medial head and medial to lateral direction for lateral head. During this treatment, insert thin sharp needle through skin to treat underlying myofascial trigger points. When muscle is overused, muscle fibers aren't getting an adequate blood supply, muscle don't get the oxygen and nutrients. Palpate and clean locates trigger point. Insert a needle through a skin directly into the move the needle around a little to try to get local twitch response. Quick spasm of the muscle, good sign of the muscle is reacting. Pricking sensation stimulate brains to release endorphins that are the natural painkillers. Gently tap the needle parallel to the muscle fibers to prevent damage to muscle fiber into the top layer of at right angle. Pistoning technique is a technique in which we move the needle in and out, quickly moving the needle up and down through the tissue. To release the myofascial trigger point, time duration for a needle short as 2 seconds to as long as 20 minutes. For superficial penetration, insert the needle 5 to 10 millimeters into the bottom layer of the skin above the trigger point. For deep penetration, insert the needle beyond the subcutaneous tissue deep into the muscle to penetrate the trigger point, which will increase the blood flow in that area. Enrich oxygen supply, which relaxes the muscle. Afterward, may feel tightness or soreness near the insertion site about 10 to 12 hours. But it is important to keep moving and stretching after dry needling and hydration. The needles are always single-use, sterilized and disposable. Palpate the area and sterilize the treatment area. Palpate the area to locate the trigger point. With the other hand, place the needle surrounded by a plastic guide tube over the area. At right angle, move the needle in and out. Physical therapists use needles to elevate trigger points. When dry needling is applied to the muscle and tissue, it can decrease tightness, increase blood flow, and reduce local and referred pain to the target area. Due to trigger points in that area, trigger point can be active and passive. They are latent and satellite trigger points. Dry needling is used in trigger points tendinitis, migraine, tension type headache, carpal tunnel syndrome, spinal issues, and night cramps. Cramps in gastrocnemius or calf muscles.